It's State Representative Tacky Chan once again for the 2nd Norfolk District here in Quincy with our Friday update. Tacky,
No,
this
it's
is more
cold.
like it. Last time we talked, you had a suit and tie on with Dr. Abe. Much-
Yeah, no, absolutely. Last time I was doing unrolling of standing grants and domestic violence grants from Department of Public Safety. Lieutenant Governor had hosted a virtual public announcement, and I was selected with the Chief Keenan and Sue Chandler and Dove to say some words about the grant they received. So they had a very limited press conference. Normally what the governor does, they like to do regional press conferences, right? So they would bring the team along, whether it be the governor, lieutenant governor, secretary of public safety staff, and make announcements for the grants, Shannon grants and domestic violence grants separately throughout the state and communities, and do like regional, like, they'll roll like 4 towns into one location, and they do an announcement for the regional paper and all that, and local cable access news. Unfortunately, because of the pandemic, they couldn't do that. So they did a monster call where they had like 100 and plus communities representation on a call with a handful of folks from a couple of places to talk about how the grant will impact their work. So, very appreciative for the Lieutenant Governor, Secretary of Public Safety, and all their staff for the work on getting these grants to the city, but also for highlighting Quincy this year through this very unusual situation of doing things through a virtual conference. So we knew that was the reason I wore a tie. I didn't wear a tie just for you.
Oh, and I thought it was just for me. Well, you look very dapper for sure, but this is much more relaxed, definitely. Let's talk about the vaccine rollout or the lack thereof, Tacky, and the problems that have cropped up this week and how they're going to be fixed.
Yeah, as people have figured out by now, the priority list is an ever-changing element, and this is part of the frustration, confusion of what's going on. And frankly, I mean, I think we all know this rollout in Massachusetts has not been all that great. We are considered middle of the pack regarding rollout vaccine. Other people, other states have moved into, almost consume all. But I think people need to understand that not every state's doing the same thing. The lack of a uniform methodology recommended by the federal government has resulted in states, and in some cases, towns and counties, depending on what state you live in, just going and doing whatever. So, for example, if you're in Texas, it's Wild Wild West. No pun intended. You literally can just go get a vaccine. Doesn't matter if you're congregate care or you're actually 18 because there's an age. But if you're 18 or you're in congregate care, it doesn't matter. So there's actually no prioritization for healthcare workers, no prioritization for people that are high risk. And you've seen that in Florida as well, where they just decided not to worry about people in the front lines and just put this out to the general public, with seniors being the priority. And of course, they're the ones who have all kinds of problems because they didn't take any safety measures early. So the most vulnerable population there are dying, unfortunately, fastest and highest. Although it's interesting, people that we know that are living there because it's winter home, or they moved out for retirement, are behaving much better than their neighbors, I hear. Local Floridians, which is, I think, kind of interesting. They still take a recommendation from people up here on what to do in COVID. So they get, I'm sure I'm not the only one, but they get notes back about appalled how people are behaving.
Well, like you've said all along, it's personal responsibility. If you have the information, it's up to you to do with it as you choose.
Oh, that's exactly it. And this is kind of the same thing happened with COVID. It is voluntary in terms of the vaccine. So there's no mandated vaccine. The reason is because if it's not FDA approved medication, we can't mandate you to get the vaccine because it's on an emergency use basis, which is causing some people some concerns, obviously, because they feel that it's only had first round of clinical, well, actually third round of clinical trials, but a true 1/3 round, and that whether it's safe or not. And as the seen on the media, many doctors, many healthcare workers, people that you trust in government, people you trust that are celebrities, that are old folks, are taking the vaccine to try to encourage people that the odds of having anything negative happen is minuscule. And like anything, you always have a minuscule chance that something will go wrong. I mean, you can get sick on any number of medications, right? Mm-hmm. I mean, most of us don't, penicillin, can have an allergic reaction to penicillin, but it's a very small amount of the population that does. And this should hopefully be a smaller, even smaller percentage than those who have allergy to penicillin, which is essential. So the state logic on the onset was that they wanted an orderly distribution of vaccine, targeting the people who are the highest risk of having COVID first. I mean, people are either going to high death rate because they're in an area where they're going to easily spread, such as congregate care. I mean, we also what happens in nursing homes and assisted living facilities. I mean, this ain't complicated.
Tragedy. It's a true tragedy, really.
Exactly. If anybody is trapped and can't move, where if you introduce one person, any person introduces the virus, it's pretty much game over. The whole thing goes out of control quickly. And, this includes places like group homes with people with developmental disabilities. People with developmental disabilities have serious medical conditions, and even they're not over the age of 60, 65 or 70, it will kill them equally quickly if it moves in that kind of setting. So, autism schools obviously have not been able to function properly because of this fact. So unfortunately, what has really happened was because once they put a priority list out, everybody wanted to move up and down the list, and people were missing from the list. And it was insufficient clarity on the list, and they had such a short, truncated time frame to try to get everyone vaccinated in a rapid time, based on the estimates given by the federal government on how much vaccine we would have, which is not the amount of vaccine we actually have.
Right.
Because
it was a perfect storm of a mess, basically. Yeah.
That's correct. The timeline is based on how much vaccine we have. We don't have the vaccine the federal government said we were going to have. And we know that Pfizer and Moderna is pumping it out as fast as again, 24/7. We know that President Biden has used the Defense Act to get the secondary products associated with vaccines, such as vials, syringes, all those other products you need to administer vaccine. He's working now to get medical plans to make those under the WAR Act. This administration continues to get input from various people regarding where they should be on the list. This has been an endless input process that's been ongoing since the list came out. And as people saw, we talked about this actually with Dr. Abe earlier in the week. We filmed on Tuesday, was it?
Yes.
Yeah. The days blend. I was talking about age 65 and how you capture age 65, even they're in the workforce. At least you get the most vulnerable people in the workforce taken care of first, which they did change actually after we talked on Tuesday.
I'm glad they finally listened to us, Tacky. So they should just ask us in the first place.
Yeah, apparently, my last call, Secretary Sutters, I was trying to explain the 65H issue, had a bit of merit. Whether I don't think I was the only one to express this. I cannot take credit for this one. I'm obviously not the only one to express this concern. But I mean, they moved from the bottom of phase 2 to tier 2 of phase 2 after age 75 above, and people with two serious health conditions, because I can't say the word C properly.
Comorbidity.
No, 2 people have serious health conditions.
Okay.
We're gonna run with that. And they're obviously doctor verified health conditions.
Yes. Yeah.
So I was just actually on the phone with boss BI Leahy, Beth Israel Leahy, Government Affairs, and going to actually open a vaccine distribution site at the State Street Bank location. There'll be signs up in the website and whatnot, and they're going to prioritize Quincy people first, and obviously they're going to outreach to their patients first. So don't just show up. They're going to set up a hotline over the weekend. They're going to have a web portal over the weekend. Things be set up if you're a Beth Israel patient to get information there. I'm aware that Manning Community Health Center is opening one at Crown Colony, where they're doing the testing currently.
Yeah.
Old Colony.
Right.
I only went to St. Anne's. I should remember this stuff.
It's right behind. It was right behind there.
I know. I remember. See, I'm old enough to remember the Howard Johnson factory back there.
Right. Yeah.
And the pickle lily odor they kept putting out. So Old Colony, where the old Howard Johnson's factory is
Yes.
what we now call the Old Eastern Nazarene office buildings.
Yes.
It's a testing site. Currently, they're going to convert that to a vaccine site with Manning Community Health Care. I do not have any more information than that either. I suspect that you will probably have as part of your news updates daily, we'll have more information than I do going to this weekend. I'm hoping that we will have more information that we can put on our social media once we have a definitive information to go up. All we got is what little I have, and we're waiting for more communication.
Yeah,
So
no, the city is working on both a phone number and a website for folks to sign up. So as soon as we have that, we'll of course let everybody know. And I know that so BI, that is not that's going to be for everybody though, right, in the state, not just Quincy people.
you're going to start with Quincy people as a priority,
Okay, all right.
and
I mean, most of it is empty right now, right? Everybody's working from home mostly, so
that's correct. So they're going to use. I'm not sure which building yet, but more details to come. But
okay.
they're definitely going to be North Quincy. They are prioritizing Quincy folks. Obviously, they're prioritizing their most vulnerable BI folks first. So people age 65 and over, people with healthcare, are going to get the first reach out. My mother, as we talked about more than once, is 78. She has cancer. So we're waiting for Tufts Medical Center in our case because her oncologist, and she's also a man patient. But we discussed also, it was a different comfort level about we're going to get the vaccine. Yeah. So obviously, consultation with your primary doctor or in our case, the oncologist is very important going in. So you can have some comfort level where is the best place for you to receive your vaccine.
Yeah. Now, did you sign on to the letter to the governor to request a call-in center?
No, because it's coming anyway.
Okay.
And the letter's going to get there by the time he puts it up.
Okay.
So it's one of those things you're like, he's going to do it. You got to get a letter. By the time it gets to his desk, it's already up. Welcome to State House life. This is what I deal with, folks.
Okay.
They want to file a letter. They want to file a bill. By the time they think it's a great press hit for the people at home, it's already over.
Somebody already thought of it. Okay.
Yeah. So this is State House life. Some folks in the place feel that they need to just take action as opposed to relaying a message up to COVID Command Center and tell them that hey, this is what's going on. You can just put it on your radar. If you need to do a letter, do a big press release at home, and it was going to take care of itself. By the time they finish their letter and their press release, it's already been taken care of, and it's claimed victory.
Which the media went crazy on it because so many people are having such a hard time with the state website.
Yeah, I'm not very good at jumping on that kind of media press stuff. Unlike some other colleagues who enjoy doing that, where they see any hint of bad news and decide they have to take any kind of action to show that the big ban on campus, it's actually being resolved already, and pretend like they actually did something.
Okay, very good.
I'm not one of those folks. I think people who have dealt with me enough over the years knows I'm not using the press in that kind of manner where I'm running out saying, hey, this I know it's going to get fixed, but I'm going to try to take credit for it anyway.
Gotcha.
I don't do that. But I just tell people, please be patient. It's the only way I can put it right now. Be patient. Contact your primary doctor. Or if you have specialty care, contact them just to be sure you have confidence in what's going on. Each place is getting different vaccines, so whether it be Pfizer or Moderna, I know some doctors are recommending different ones for different folks for different reasons.
Oh, okay.
It's good to have that conversation. Definitely check your emails. I've been told by Beth Israel they're going to be emailing their patients as soon as they have a schedule in place and how they're going to enroll it and which of the most high risk people of dying will be contacted, in those orders. So they're working on an internal method right now to identify their, highest risk of death folks.
Okay, good to know.
So expect possibly a phone call. Definitely expect some emails. Different hospitals and healthcare facilities will have the web portals up, as we talked about, and the phone numbers over time. So just be patient. February 1st is the start date. I know people are trying to get ahead of the game, but also be mindful we do have a supply problem because we don't have enough vaccine.
Right.
And just those two issues, as you've seen over the news, do we need that second dose this soon? A lot of reason that people haven't got vaccine and we have some extras because the second dose issue.
Yep.
And other states have just burned through everything and do not have second doses available. Again, this is new science. First dose does protect you. Second dose improves the situation on protecting you. But then again, if you're, like I said, if you're high risk death category, for lack of a better term, obviously you want to have the highest protection.
Sure. Yeah. It's a good idea to remind folks now, too, that there are some scams out there and you should not be having to pay, right, for a vaccine.
Yeah, great reminder again. Vaccine is free. The government is paying for it. The federal government's paying for this. I believe it's $62 per shot. I think the secretary told us. I think Medicare is picking up 45. That's how they're doing it through the Medicare Trust Fund. Um, I think the state's gonna have to figure out how to come up with the rest, but we'll figure out how to pick up the remainder. And then you cannot pay to get ahead of the line. You cannot pay to not get a shot. You cannot pay to get a shot. You don't pay. You don't get financial information, social security numbers, personal information, or any kind of information until you actually go to the location and get your shot.
Right.
The web portals and the phone numbers you're going to get from the government are the ones you should use. Do not use any other party's numbers. If you're not sure, call us. Not sure, call your healthcare provider to confirm that that information is the information you should be using to contact to get your vaccine. So you're not confident of information you got, call your healthcare provider or call our office and we'll try to help you out.
Great.
Visit 617-722-2014, 617-722-2014. Call us if you're not sure the number you got is right, but definitely call your healthcare provider.
Absolutely. Yeah, it's great advice. And we'll hopefully start to build, some herd immunity here over the next 6, 7, 8, 9 months or so.
Well, I saw an article, speaking of herd immunities, because we're going to digress like I always do in these things. I need to read the whole article. I only got like parts of a headline. One country is, I think it's Malaysia, I think. I have to look it up again. It's looking to inoculate healthy people before the vulnerable people. Because people who are healthy are still carriers despite not having symptoms.
Interesting.
The logic is actually interesting. It's very inverse logic. The logic is that if you inoculate healthy folks who are carriers who do not present symptoms first, you create herd immunity among them, and the vulnerable populations have a much lower risk of getting COVID because the people that are carrying the virus are unable to
transmit it. Yeah, interesting. That is very interesting. And also, the people who are carrying it but are asymptomatic are just out in the community more, right? Just they're not sick.
I've heard yet another person got COVID, and yes, they were asymptomatic, and yes, they were basically a walking spreader.
Yeah. Huh,
and
very interesting. I'd be curious to see how that pans out.
Yeah, I'm actually kind of curious too. I got to look up the article again as I'm reading random news. It is a very curious way of going about this because our logic is, we got to help the people who are going to die first. The logic there is that we can help the people who die first by ensuring they can never get the disease from someone that's an unknown carrier.
Right. Yep.
So
there's you flying the ointment of these variants of COVID-19.
Yeah, as we've seen by the news articles, and you've seen by England in particular, the United Kingdom, Britain. I love the fact it has like 5 different definitions of a country. Definitely, because it's an island nation, that universal health care and the hospital system cannot handle the load. They already, like Massachusetts, they already had ramped up the entire healthcare system to prepare for wave 2, and it's getting overwhelmed very quickly. So, obviously they have taken the most severe measures, complete total lockdown, shut down and travel and so forth. I mean, much more heavy than we've done, and it's still battling it. And they have that higher contagious level, which can be between 40 and 70%. I know 40% comes up a lot, but it's like potentially up to 70% more contagious. You have the variant in Brazil, the variant in South Africa. These variants have already traveled the planet, despite the fact we have limited travel.
Right.
A lot of travel is very limited, very little leisure travel, very little business travel, but it's still a lot of cargo travel.
Oh, true.
Food, goods, all kinds of movement of mail. People are still moving around the planet. So give you an idea of the level of contagiousness, despite the global reduction in travel. These variants still made its way to the U.S. from South Africa and England and Brazil, made its way to places like South Korea. I mean, this thing is that contagious, and the asymptomatic nature of it, makes it such a great danger. And right now, what we see in the news, it doesn't appear to be more deadly. The problem is that if it spreads faster, it just makes it more deadly automatically.
Right. Yep.
And, there's some question about whether or not the South African variant is actually more deadly. And people are trying to figure out specifically whether the scientists are able to figure out specifically whether the variant in South Africa is tougher than the vaccine is able to do. So it basically, the vaccine already does teach your body what to look for to kill it, or a very simple definition. Is the South African variant sufficiently different that your body won't recognize to kill it?
Mm-hmm. Mm-hmm.
I think that's the simplest way I can put it, which is why we always say, and I say again, even if you're vaccinated, wash your hands. You can still be a carrier because the virus can be in the outside of your body.
Right.
It is unknown how long it takes to kill the virus in your body. So if you have it in your lungs and you breathe it out before your body kills it all, you're still a carrier.
Right.
Hence, wear your mask. Use your hand sanitizer. Wash your hands. Keep your distance still, even if you're vaccinated. Okay? So this is the question about the South African virus, which, reading the news, they're trying to figure out. Because if it's sufficiently different enough that your body doesn't rapidly recognize, kill this, then we have a bit of a problem. So the efficacy rate, would not be as good if not everyone body knows through the vaccine to kill that virus.
Yeah. So much still unknown because it's all still so very new. So we're, as the mayor said to me once, we're kind of building the plane as we're flying it.
Oh yeah, we're building it, we're flying it, well, it's falling on fire. I mean, this has kind of been the way it's been going. Thankfully, it sounds like we did put out the fire and we're not falling, but we're still not riding a smooth ride.
Yeah.
As we've talked more than once, every time I'm on this podcast with you, everything I said from last week seems to go out the window. So, if you want to take advantage of political faux pas, this is the whole 40 plus videos of me every week probably not being right because next week a new information comes up.
Right. Yeah. So let's switch gears a little bit, talk about something we haven't talked about in a long time, Tacky. The census. And the city clerk here in Quincy tells me that possibly they may be reopening the federal census. Have you heard anything about that?
Oh, God.
I guess not. It's up to the new administration, but that's what she's hearing.
That'll be interesting because under the Constitution, it requires a head count of the decade. We're not in that decade anymore. I don't know how that would work, to be honest with you, because the Constitution is pretty clear when the count has to occur.
Okay, so there would have to be an amendment, probably, an act of Congress.
Really don't know how that would work, quite frankly. They could continue a count, but it wouldn't apply to things like redistricting.
Mm-hmm. Okay.
Continue a count, and it could still be used for like federal formulas based on population. It could be used for obviously scientific data or demographic data for historians and things like that as well. But I'm not sure you can actually do that for redistricting because that's the first point of the decennial. Is it decennial is the word? Every decade census is for the redistricting purposes. The estimate right now is that we are short like 1,900 people from 2019. So we are actually, because it wasn't. You don't actually do a real count between the decades. You do statistical sampling and do the analysis. The statistical sampling showed that 2019 we should have more people than the actual count in 2020.
Yeah.
Actual count. And I know it's like 1,900 people or so. It doesn't sound like a big deal, but it is a big deal because every person's needed regarding ensuring our proper representation in Congress.
Right.
Some states like California definitely lost population. Some places like Texas picked up population. Some small states picked up some population because of just people migrating and birth rates. So I actually do not know. That actually is curious because we know they can keep counting. That's not the issue.
Okay.
The issue is, what is the count we're going to use to determine the districts?
Okay.
And that's a very good question. Again, we're hoping that we got to 100,000 people in Quincy because it changes our HUD formulas immensely in terms of grant funds. And it actually has an incredibly positive ripple effect to get to 100,000 people in Quincy. But the state as a whole, Massachusetts as a whole, really needs to keep the count up because I don't want to lose a congressman. because I have to vote on that. If in case you were wondering, if we lose a congressman, the legislature decides how to cut those congressional districts. So we end up picking who loses, or forces two people to run in the same district situation.
Right, right.
So I'd rather not find myself in that position to do that a second time, because we already did that a decade ago when we lost Congressman Oliver.
Mm-hmm.
When we basically took the Berkshires and everything in Western Mass and created a monster district for Congressman Neal, who's now the House Chairman of Ways and Means. So that kind of worked out for us. So it'd be, yeah, you know, people at home like, oh, that's not a big deal. Well, you don't have to field, calls from people on a state level regarding saving their congressional districts.
Right. All right. Well, stay tuned for that one then. Do you have your committee assignments yet, Jackie?
No, we do not. We did some temporary rules on Wednesday. We had a session Wednesday, and the temporary rules are two. We did one for the continuation of the emergency rules we're operating around with some caveats. So, for example, as we talked about, basically flying a plane while building it, or smoking on fire on it, and the whole thing. And we discovered last year we had some problems with virtual dial-in through Microsoft 365. One is we keep getting dropped on calls. Another is that I get buzzing sounds every so often. And sometimes you just keep saying stuff but no one hears you, but you don't know for 10 minutes.
Oh, okay. That's a problem. Yeah.
Yeah, so we're using Microsoft 360, folks. If you guys are doing this at your business, and we're trying to do our secured conference calls this way, and the technology is hardly perfect. It's all by voice, not by video. So we have to, no joke, sometimes we, chatter just to ensure that people are still on the line, because silence is not a good sign.
Right.
But we also can hear the entire debate via the telephone. It's out of sync with the computer, so we don't turn the computers on because it's going to be short by about 45 seconds of the delay. So everything's very focused on listening as opposed to watching. And I like to watch things because I'm a visual person.
Mm-hmm.
So listening actually requires a lot more concentration. So we made some corrections to the rules that we discovered that were problematic, such as addressing technology problems. Try to reflect properly that you can still have access to all the rules and privileges allowed within reason. So certain things like points of parliamentary procedural questions, points of interest questions, unanimous consent to make a statement things, we put those in there. And because you're working virtually, we need a mechanism by which you can announce you want to make these statements. So you have to contact a monitor who is in the State House, who's a representative, who's your monitor on the phone, and establish means of communication. So text messaging while on the phone has been critical for all of us. To relay to our monitors that, hey, I got a point of parliamentary inquiry. This is what it is. Please inform the chair. And then they have to inform the chair. Then they have to patch us through. Then they have to dial a separate number.
How cumbersome is that? Yeah. Wow.
You can see the challenges of the session we're having. And while we're not the most speediest folks, I'll fully admit to that. It is even slower than normal.
Yeah.
We have to sign up before we debate. They changed the rules regarding on sign up on the fly during the budget associated with consolidated amendments, but they also made it more clear regarding how many statements you can make on an issue regarding one specific amendment, for example, one specific bill. So there's some more clarity in that area. And then they did some stuff regarding some more clarity on time and time for debates and things like that. And when we're opening session, no later than 10 a.m. No, we can't go past midnight without unanimous consent of the membership. So we tweaked the emergency rules to be effective to the end of the fiscal year, and actually, it's right, end of the first half of this first 6 months of the session,
Mm-hmm.
which were in July. So we pushed these emergency rules to July with the hope maybe we come to semi in-person functionality in the second half of this year. We hope.
Yeah.
So
Yeah.
So yeah, we're hoping.
A lot of hope this year for sure. Yeah.
Yeah, we're Microsoft 360. We're learning as we go. Even if we are able to come back in person, I suspect it will not be in large numbers at one time. I think that some level at home work is here to stay.
Oh, I agree. Yeah, I think that's very true. Or at least some combination. Yeah.
Yeah, in the white collar industries in particular. I think at some level, not everybody, but I mean, I think a substantial number of businesses and government will implement some type of work at stay home. And this is actually good for us in implementing our secure systems for remote work, which means I can access documents on my server. We just got it over Christmas time. So I can access documents on the server. I can access my archive email while not at the office through the secure VPN, encrypted, etc. System that we're using from the house. Which is great because when I go on vacation, I can access all my work from my cell phone now.
Oh, what fun will that be?
Which is great, just wonderful. That no matter where I am on the planet now, I can get to all my work as long as I can get an internet signal somehow. So that's a positive point of this.
Well, it's a double-edged sword for sure. Yeah, no question.
Oh, that's very true.
Yeah.
So, I think we will, as I said before, I think we're going to continue to work this way throughout the rest of the year. I do think that we'll maybe, hopefully, have some partial something going on in the second half. But then again, we don't know how this vaccine is going to work in terms of we need more boosters to go along. How long does your body remember to kill this virus or the blueprint out of this virus? And there's also the continuation effect that when are we going to reach herd immunity?
Yeah. All questions, no answers right now, right?
Yeah, we want a even distribution. So I mean, even if you got 70% of the population vaccinated, but if they're all located in California, that doesn't do us any good in Massachusetts, right? Same thing in the city of Quincy. If you have 70,000 people, for example, vaccinated, you still don't have that 30%. But let's say Weymouth only has 10% vaccination. There's no herd immunity, and we transverse borders. It isn't like we're contained in a fishbowl here. So it is very important, I think, on a regional, national level, that this herd immunity issue occurs through vaccination. And if one segment of the country and one community does not reach a high level of vaccination, it only negative impacts everybody else.
That's right. People travel. That's exactly right.
Exactly. We learned nothing else from COVID. It's all about movement. And then we still have to think about the children, which clinical testing has already begun. Well, we do know that children are lower to suffer severe illness as they do, but it's lower, and they have a very low death rate. They also are carriers. They can be carriers with mild symptoms, which can give it to you. So that vaccine for the kids are very important. In the rough estimate in Massachusetts, we have to vaccinate 4.1 million adults. If we get 100,000 doses of vaccine a week, and somebody able to do that, you're still talking, 40 some odd weeks or more? I mean, that's assuming you get that many doses, assuming you actually have the capacity to implement that many doses a week. That's like the super ideal situation. That's 40 weeks. I mean, the year's almost over.
That's right. Yeah, it's going to be a marathon, not a sprint, for sure.
Yeah. So my joke about getting vaccine in October may not be that far off.
That might not be so funny after all. Yeah, exactly.
So I digress. So the second thing we did on rules was opening an order to have the rules committee review our current rules that we're operating regarding its efficiency and procedures to see if there's any updates because of the way we operate today. We've learned some lessons from COVID, so it doesn't hurt to see how much of the things we learned from COVID can be implemented into our regular rules going forward once we get out of COVID. And secondly, to look into legislative, basically looking to lobbyists who are lobbying, who aren't registered lobbyists. So there have been over the past couple of years, there have been folks in the bill have expressed concerns about individuals who are basically being paid by organizations to lobby us on various things, but are not registered lobbyists. In Massachusetts, if you spend 15% of your work time lobbying us or any government agency, includes cities and towns and counties and the federal government, well, the federal government has all kinds of other ones. So basically, cities, towns, county, and us, you have to register a lobbyist. I believe it's 15% of your work time.
Okay.
So, as a result, not surprising. If you look at the lobbying book, it's extraordinarily long because big corporations are very hesitant to violate the law. Mm-hmm. So, for example, you have CEOs, COOs, CFOs of many big corporations who are registered lobbyists. but we never see any of them. They do it as an abundance of caution in case they need to come testify, in case they need to speak to legislators on a more frequent basis for a short period of time. They do it as a precaution. So we actually have a very long lobby list, but people who are actually engaged in lobbying is probably less than 200 folks.
Okay.
But that's kind of inside baseball for everybody. So you pull up the lobby book and the Secretary of State's website, the list, you see, oh my God, there's so many lobbyists. Well, yeah, but of the people that actually show up in the building regularly, it's less than 200. People who are really regulars are less than 100.
Okay.
True career lobbyists, not just government affairs for a business, like the ARP as a government affairs person.
Right. Yep.
They lobbyists, but it isn't like their job is to be there every single day.
I see.
That's less than 100. So there were concerns being expressed on whether we can actually better identify folks who are not complying with the law, because the only way we know they don't comply is that we have to find them. And we've been receiving folks, well, including myself, receiving from different folks we can't identify who they are because they're not in the lobbying book.
Oh, okay.
And so they're lobbying us not as citizen lobbyists. So if you come to my office and say, hey, Tacky, I want to talk about an issue. Oh, sure, Joe, let's sit down and chat. You're lobbying me, folks. Right. I mean, that's called special interest group. You come and talk about anything, you're now become a special interest group. Don't be like, oh, no, I'm special because I'm not a special interest group. No, you're a special interest group now. And you want to talk about an issue, you're officially lobbying. The difference is that if you're being paid to do so by your business to push an agenda forward versus being a private citizen, that's different.
Gotcha.
So Sierra Club's my favorite example because they're the ones who want to do this the most. They lobby their members to come see us and talk about stuff. It should be once a year, twice a year. They do that, but the citizen actually volunteers to do that, and they're not like trained employees. They're kind of like, here's a fact sheet, go and talk to folks.
Yeah.
And we are talking about, honestly, I mean, people who visit my office knows I talk about your issues. We talk about what's going on in your neighborhood. We check in your family. We talk about all kinds of other issues beyond just that. What's happening is some organizations are now basically training people to work on their behalf to lobby us. So there's no longer would you like to visit the legislator about an important issue? It's up to you if you want to do it. No, it's we're going to train you and send you in unpaid, the keyword's unpaid, to lobby.
Oh, okay. So not really a lobbyist, but also that's their only mission.
That's their only mission, to train other people to lobby on their behalf, uncompensated. And of course, people training them are compensated. So what do we have here now?
So why would someone do that if they weren't being paid?
Well, because we live in a fervent political times at the moment.
Okay.
And the need for righteous causes, in spite of who you support in the political party, I think most of us who are observers and reasonable folks, I would believe we're reasonable folks, see that people have really clung on to truths or untruths. I'm trying to be very polite about this now. That will invigorate them to want to take this type of training to propel someone else's agenda unknowingly.
Oh, okay.
Or perhaps knowingly, but I would tell you most likely unknowingly what the rest of the agenda is, because people they talk to think they know what's going on.
Gotcha.
And then, of course, we do these podcasts. I tell you how things work.
Right.
And I've done this with some folks in my life in the past, and the thing they hate the most dealing with me, which is why I don't like calling me, is I'll actually ask a question. They're very used to the experience of people just sitting there nodding. I don't nod. I like to ask. And
well, that's the only way to really find out, right?
Yeah, it's amazing how you get offended by asking a question. It's like, you're here to listen to us. I'm like, yeah, I am. I got a question, though. And
you can't take action if you don't know where they're coming from and what they're looking for.
Well, it's called a discussion. I mean, no one likes me talked at. I mean, I've been talked at. Everyone has that experience at some level, and sometimes you do it accidentally. But I mean, we try very hard not to talk at people. I think as a culture, we try to. It happens sometimes by accident, but we try not to. The legislature only works if we facilitate conversation. And one thing that a lot of new legislators find out the first year is what they thought the place would be, what it really is. It's two different things. So they remind folks, this ain't West Wing by any stretch of the imagination. And as you have conversation with folks, you learn how things work. And it's a kind of a passing knowledge, institutional knowledge. You pass it from one person next, you pass it to the next person next. And as the building changes, always a change, not just in people, but in operations. COVID has shown we had to change.
Mhm.
We will continue to pass that knowledge on. But if you don't have anybody to pass it on, you have no passage of knowledge. It's no different from anything else in life. The government is no different. So there's a benefit for people, senior members, to pass knowledge to junior members, who then become senior members, who pass knowledge to new junior members, and the cycle continues.
Sure. Yeah. Can we switch gears a little bit, Tacky? Talk about the governor's budget proposal and what that might include for Quincy.
Well, the governor put out a budget 6 weeks after signing the budget for last cycle.
Yeah, well,
So-
things are a little slow.
Yeah.
Yourself, you were a little slow. Things got pushed ahead. I know you were on a monthly budget basis late last year.
Oh, absolutely. It's been one of those years, and I think that part of the joint rules conversation for the bigger joint rules, not the emergency rooms, discussing about moving some of the internal dates and budget processes to reflect the current COVID crisis also. So that I know that's the conversation, because we ran into a problem in rules last year regarding the dates of due dates in internal rules. So the governor's budget is about $45 billion. It's not much bigger than the budget he signed last time. It's about the same. We're projecting about $30 billion in income tax revenue. The federal government still contributes, as you can tell, it's $45 billion minus 30. We get less than $2 billion in fees and stuff like in the lottery, but lottery really just goes straight to local aid. I don't get to spend money. The money goes straight to your cities and towns. So the mayor spends that money in the council. So
Right.
that's where lottery money went. So don't talk to me how that goes.
Okay.
Talk to them. The federal government still becomes a very big partner of over $12 billion of our budget is from the feds, largely Medicare, Medicaid reimbursement. And hopefully with the Biden administration and the Democratic Congress, we'll receive more COVID assistance at minimum, hopefully, as the year goes along. Obviously, we would like more federal assistance, but we'll take anything. We've talked about this before. The budget continues to follow the same pattern of putting the MBTA, the School Building Assistance Grant, and the pension liability first on the list of money to be taken out first. So the $30 billion in income taxes, we're looking at probably about 26 billion of actual money that we can use. A lot of funding, it's actually COVID related. No big surprise. We did it last term. We're doing this term. The big change here is that he's actually going to try to implement education funding reform that we approved last year and suspended. So he's going to go for that implementation there. He wants to try to raise revenue through implementation of sports gambling. He wants to raise revenue through cashless lottery, which means we have legislation looking at debit cards to buy lottery tickets via debit cards, not credit cards. He's looking to get some money again by suspending the charitable deduction on income taxes again. So we suspended it for this fiscal year. He wants to suspend it for next fiscal year, and he's looking to draw another $1 billion down from the rainy day fund. Just a reminder for folks: the rainy day fund going into COVID was about $3.5 billion. We drained about $1 billion plus out of the rainy day fund to balance us with budget. So it's about $2.5, give or take, billion-ish dollars. The governor draws yet another $1 billion to balance his budget. So that shows that we are projecting, obviously our projections still continue revenue shortfall if we have to draw from rainy day. No more rainy day money went into the fund last year because we took the capital gains tax, which is only going to rainy day fund. All capital gains goes to rainy day. Was spent last year to balance the budget. So the rainy day fund did not have an additional because we just drew and took the money that was supposed to go that way into rainy day. So they're obviously we're drawing from those funds. We are not expecting strong tax revenues based on prior year projection. We're expecting better, but not strong enough. And COVID has increased all our costs just because of the nature of COVID.
Sure.
And we don't expect that to stop anytime soon. So at this stage, the governor's budget is a recommendation. It is not the budget. The budget starts in the House. So
Right.
I like books. This is where it really begins. And we're probably going to use the same revenue consensus number, about $30 billion, and build off of there. And the hard debate's going to really be about how much rainy day fund we're going to use, because we don't know how people are going to get federal assistance, and we don't know what the outcome of the pandemic will be as we move through the summer. We all want it to be better, but you need to have resources in case it goes bad. But plus, we must maintain the current system we're living in now. So all the services you have plus COVID is what we need to try to maintain. And given the governor wants to implement education funding reform, we're going to be under a lot of pressure to do so. So we're going to have to figure out how to implement education funding reform too.
And that's what, $1 billion?
Yeah, essentially $1 billion to the city of Quincy. I'm trying now. I'm going to remember math on top of my head, but I believe it's $8 million more in education funding a year.
Yeah,
If I remember, yeah, I think that it's 8. And the governor's office expecting a very robust lottery. He's expecting $1 billion in level lottery revenue. You guys, it doesn't take hard to figure out. You guys all figured out that the lottery was impacted by pandemic, right?
Mhm.
No Keno because no restaurant and bars. People are traveling less. A lottery ticket was not a priority item at the store when you're shopping. Obviously we're stocking up, so there was an impact. But because of the Mega Millions Powerball shows that we're coming, people are buying tickets again, even though it was a long draw because not a lot of tickets were bought early on. It shows that nationally there is some movement again. So I think the government may be a little optimistic at $1 billion. I think maybe close to 950, 970 maybe realistic, but we continue to hope for the best.
Okay.
So, stay tuned as the House goes through the budget process. I'm waiting for our regular meeting of the Ways and Means Chairman, which is probably going to be done in this format for less than 15 minutes. I talk extremely fast, and we email the priority list to them for a first peek. And as committee chair, I hope, we hope, since I don't have assignment, whatever the chair is, obviously I have to look at the budget of the agencies I oversee as well and make recommendations to the Ways and Means Committee about what my thoughts are regarding the agencies the committee interacts with. So there's that factor also. So stay tuned as we continue to do these Friday talks. We'll probably be talking budget more and more as we get closer and closer.
All right. Sounds good. This is the point in the program where we let folks know how to get a hold of you.
Yep, you got the phone number a bit early, but we do it again. 617-722-2014, 617-722-2014. I am aware that some constituents had a little issue with the phone system, but push anybody and leave a message. Don't worry about what the job description is. Just push anybody on the staff. We'll get the voicemail. Send me an email at tackey.chan@mahouse.gov, tackey.chan@mahouse.gov. My mailbox is now starting to get filled with people asking for bills and bill requests. So we do prioritize people with immediate needs. And right now, we're still getting a lot of unemployment requests, issues, all kinds of problems regarding accessing the system, whatever heard from a while, they sent the documents in, and they're having some problems with customer service, essentially. That continues to be the real number one email and phone calls we're getting. We do put a lot of public information at the public public social media, my Facebook, the Tackey Chan, State Representative Tackey Chan on Facebook. Don't forget the E in Tackey. That's happening. I've discovered for folks.
Oh,
But you can find it. Yeah, just you can Google it. It comes up. You don't need to own a Facebook account. Just keep scrolling down. We put a lot of stuff up there. Do not. If you're my friend on Facebook, there's nothing for you. I'm sorry. Just go to the public site.
Okay.
We're not going to start. We tried doing double posting early in COVID and realized this is just unnecessary. We have a public Facebook site. Please join in and use it. TackeyChan.org. Again, we have a website. We're going to try to update that as soon as we get new information. And of course, we have QATV with you. We put the links up on the website. So if you want to see everything I said that was wrong before, you can find them there. We do put the links up on our website.
Yes. Okay.
You can help yourself and
Okay.
see the corrections the week after. Or watch how my hair grows. Whatever makes it work for you.
Right.
So those are the numbers you can contact me. And we are still getting, we're going to say the inundation of calls right now really is continuation of the.
Yeah. Well, yeah, and of course the big news, Beth Israel Leahy coming to State Street here in Quincy, right, for a vaccination clinic.
Yeah, that is the big news. So if you're Beth Israel Leahy patient, be a little bit patient through this weekend on getting an email from them regarding prioritization of vaccine access based on doses available. Uh, you think about it, it's not a lot of doses when you think about how to distribute doses around the state as equitably as possible. If you're a person that has a comorbidity, serious health issue, I can't say that word.
Oh, you said it. That was pretty good. That was good.
That was close enough?
Yeah.
If you have one, two, or more of those issues, definitely contact your primary physician to find out where that status is, particularly if you're like part of doctor's group. And if you're uncomfortable on your choices in terms like a pharmacy or Gillette, definitely pick a healthcare setting that works for you. I do advise that. So if you need to be at the hospital setting or a hospital operated setting, be patient and do so. In the meantime, wear your mask, wash your hands, everything I've been saying every single week. Keep that up, even if you are vaccinated. Because if you're a senior citizen, you have vaccinated, doesn't mean you still can't be a carrier and infect your children or your grandchildren.
Right.
So it's no guarantee. And is it you and me, or do we know more people with COVID than the first time?
It's funny you say that, Tacky, because I was thinking it seems to be getting closer to my circle of people than it was the first time around. Yes, I would agree with that.
Yeah, the 7 degrees of separation of Kevin Bacon seems to be shrinking very quickly.
Yeah, I don't know why that is, but I think it is. Yeah, I think a lot of people are experiencing that too.
And I think people should have greater cause for concern given the fact that you know more people or you have more people close to you with COVID indicates exactly how even more infectious this is. And we didn't do a full lockdown this time. I mean, it wasn't even a full lockdown last time. It was like a 90% lockdown.
Yeah.
But I mean, we didn't even do a full 90% lockdown this time. And that gives you an idea how a difference makes of a 2 or 4 week lockdown versus a much more moderate lockdown we had this time and the impact of each. So, we've had several more members in the House contract COVID. So, I mean, we got that noted in my colleagues and so forth. And, I have personal responsibility to my family, and, I'm not bringing this disease home at all if I can help it. So, everyone please be safe, be well. And there is light at the tunnel someplace. It's just the light is not that bright yet, that's all. But it'll get brighter later.
That's right. Thanks, Tacky. Good to talk to you.
Good to talk to you. Talk to you in a week.
All right. Bye-bye.